get all done? Okay, good to get my audience. It is recommended that babies be exclusively breastfed for the first 6 months of life. The current national average for babies being exclusively breastfed for the first 6 months is at 18.8%. Breastfeeding report card, cdc.gov. Breastfeeding rates in America have been declining due to increased responsibilities of women in our society. Most of the difficulties that they are facing could easily be addressed with resources and support. Many of you have either experienced the stresses of breastfeeding recently or will sometime soon in your life. I am currently breastfeeding my 3rd child and having much more success this time due to increased knowledge and resources and support from family members. I intend to introduce to you some of the problems that women are facing and provide some solutions that may help increase the national average as well as help you. Women of today face multiple barriers to success in breastfeeding, which if properly addressed, could be eliminated. Working outside the home is related to a shorter duration of breastfeeding, and intentions to work full-time are significantly associated with lower rates of breastfeeding initiation and shorter duration. Support for breastfeeding in the workplace. Low-income women, among whom African American and Hispanic women are overrepresented, are more likely than their higher income counterparts to return to work earlier and be engaged in jobs that make it challenging for them to continue breastfeeding. Support for breastfeeding in the workplaces. Many of these jobs are low paying as well. Some of the main jobs that make it more difficult to breastfeed are fast food and factory work. These jobs, being low paying, also make it difficult for them to afford formula in place of breastfeeding. New mothers face difficulties with continuing breastfeeding upon return to work because they're unaware of the resources that are available to them and don't know how to continue breastfeeding once they do return to work. Many women face difficulties with latch and positioning as well as perceived insufficient milk supply. When babies don't have proper latch, it can cause increased pain and improper feeding, as well as the same difficulties with positioning, and that could be easily fixed using a lactation specialist. Mothers oftentimes think that they have inadequate milk supply and won't be able to satisfy their baby's needs. New mothers are also unaware of the benefits of breastfeeding to mother, baby, and financially. New mothers may choose not to breastfeed for personal convenience or perceived difficulties with continuation. There is little information available regarding the benefits that are available for babies with breastfeeding, and new mothers are also unaware of the financial benefits of breastfeeding. Many women lack the support necessary to breastfeed. They lack support from spouse, family, friends, and community. Right now, breastfeeding is being stigmatized by the public and viewed as inappropriate in public places. Also, family members are not supportive of breastfeeding in public places. They're embarrassed, and they're also annoyed by the time constraints that breastfeeding causes for the wife. Given proper resources and education, women can increase their success rate for breastfeeding and continue to breastfeed for longer durations. Proper support and resources at work prior to return to work can make it easier for women to continue breastfeeding for longer durations. Training for women regarding pumping and milk storage would be beneficial for their confidence when returning to work. Proper accommodations made for new mothers will increase happiness and success with breastfeeding. Ideally, a nursing mother room is centrally located with adequate lighting, ventilation, privacy, seating, a sink, an electrical outlet, and possibly a refrigerator. Employers can use many different strategies to ensure time for breastfeeding or milk expression, including flexible work schedules and locations, break times for pumping, and job sharing. Support for breastfeeding in the workplace. Proper education related to latch, positioning, and milk production should be provided prenatally and postpartum. Training on what to expect should be given prior to delivery. Women should have prior knowledge and know what to expect so that they can be comfortable with the task at hand. Lactation specialists should be available after delivery to help new mothers with problems that may occur. Assistance with latch and positioning will help new mothers reduce pain and difficulties with feeding. Women also need to be aware of the assistance that they can get with insurance. The Affordable Care Act, effective August 1st, 2012, helps provide women with breast pumps for free or lower cost through most insurance plans. The the Affordable Care Act, breast pumps, lactation services, and coverage. New mothers need education related to benefits associated with breastfeeding so they know the positive impact that it can have. Breastfeeding provides many benefits to a new mother. It can help reduce the chance of breast cancer, ovarian cancer, and type 2 diabetes. womenshealth.gov. Breastfeeding also assists with involution of the uterus in the weeks after delivery, as well as weight loss. Breastfeeding provides many benefits to the baby. Breastfeeding can reduce the risk for SIDS, childhood obesity, ear infections, and respiratory infections. womenshealth.gov. It can help boost the immune system as well. Breastfeeding is also cheaper than formula feeding. Formula feeding for the first year of life costs approximately $1,200. Breastfeeding also provides additional opportunities for bonding with baby. New mothers need to be supported by everyone around them. Education needs to be available for family and friends so that they can be as supportive of the new mother as possible. Workplaces need to provide supports for breastfeeding women. These supports can be as basic as providing an appropriate area for pumping, or they could go more in depth with a lactation specialist on call. Public understanding and support of breastfeeding would create huge improvements for new mothers. There is no reason for them to be ashamed for feeding their children in public. While breastfeeding rates in America are dropping, there are simple steps that can be taken to help improve the number of women who choose to breastfeed. Training and education, along with support, will lead to higher numbers of women choosing this option for their baby. I have managed to successfully breastfeed for 4 months so far, and I know that this is largely related to more knowledge and resources that I know are available this time around. I know that the rates would increase with the proper help. There is no reason for women to suffer through breastfeeding when there are so many different opportunities for assistance. Hospitals and doctors need to take the time to let their patients know the options that are available to help them. By working together, we can increase the breastfeeding rates and keep our babies healthy.